commonest topic which they ask in exams regarding the rickets. It has a lot of subheadings like introduction, pathophysiology, clinical features, investigations, treatment. Number one, they ask in exam whether it is a disease of growing bones or non-growing bones. That also we always get confused. So please remember, it is a disease of growing bones. Growing bones, as in when the baby will be growing, then you're gonna have a problem with the clinical features of this disease. Like for example, if you're making a house, you have a ground floor, first floor, and second floor. Just imagine that you made the ground floor, but before even the drying of the cement, you started making the first floor. Before even the finalization of the ground floor, you started the first and the second floor, and the ground floor is weak, weak, and weak. So this is something happens in a case of rickets. So basically this is because of deficiency of vitamin D. Because of the deficiency of vitamin D in our body, we get this problem. So number one, you should know that rickets, it is a disease of growing bones. It is not a disease of non-growing bones, because there's something known as osteomalacia, which is also again some bone problem, but that is seen in adults, and it is a defective mineralization of the non-growing bones or the static bones. Whereas rickets is specifically, it is a disease of the what you called defective mineralization of the growing bones, that you should know. Okay, so rickets is the growing bones and osteomalacia is non-growing bones. Rickets is seen in pediatric population and osteomalacia it is seen in the adult population. One more thing we should know, it occurs in children only before the fusion of epiphyses. It occurs in children only before the fusion of epiphyses. So we all know this is the parts of the bone. We have the spongy bone, medullary cavity, and then we have the compact bone. Very, very important. We have the main shaft, which is the diaphysis. Then the connecting in the E for end, E for epiphysis, M for middle, middle is the metaphysis. So diaphysis, epiphysis, and metaphysis. And rickets occurs in children only before the fusion of epiphysis. Yes, now this is the most important mechanism where the whole class will revolve. So whenever from we always say in which population do you see the features of vitamin D problem. So we all know the one who wear parda system, or the one who wear hijab or burqa. Those people are like not exposed to sunlight much, and when you are not exposed to sunlight much, you're going to have a vitamin D deficiency problem, that is rickets. So by sunlight, you have something known as dehydrocholesterol. D for daytime sunlight, D for dehydrocholesterol. Dehydrocholesterol gets converted into vitamin D. Dehydrocholesterol that converts into vitamin D. This vitamin D gets converted into 25 hydroxy vitamin D, and that gets converted into 125 dihydroxy vitamin D. It's very simple. D. The mnemonic is D, then D, then D. D for dehydrocholesterol, D for vitamin D. D for vitamin D, D for 120, D for 25 hydroxy vitamin D, and the end conversion is into 125 dihydroxy vitamin D. Okay, and liver and kidney plays a very important role. The conversion of vitamin D to 25 hydroxy vitamin D happens in the liver, and 25 hydroxy vitamin D to 125 dihydroxy vitamin D happens in the kidney. So if you have a kidney failure, if you have a renal tubular acidosis, you have an acute renal failure kidney, if your kidneys are not working properly, you're gonna have a vitamin D deficiency features. Your 25 hydroxy vitamin D will not get converted into 125 dihydroxy vitamin D. Okay, so that's the main story which you need to know. And liver also plays a very important role. And the one who are vegetarians, this also we ask in exams, people who are pure vegetarians, they have this problem because dietary very difficult, in a very less amount through the diet you get this vitamin D2 and D3 you get from the diet. So that's what. So by the sunlight, if I have to get the vitamin D, I will get by dehydrocholesterol, and vitamin D2 and D3, which is like ergocalciferol. So that I can vitamin D2 and D3 I will get through the diet. Okay, so that is one thing. Second thing we have over here is what else? So that's it. Vitamin D into 25 hydroxy vitamin D. The enzyme responsible is 25 alpha hydroxylase, and 25 hydroxy to 125 dihydroxy vitamin D. The enzyme responsible is 1 alpha hydroxylase. This also they ask in exams, like 1 alpha hydroxylase, what is the enzyme deficiency is there, like that. Yeah, so this part is done, and yeah, that's it. Okay, we'll go to the next slide. Yes, so we all know, like the one liners or the MCQs questions. Vitamin D is commonly absorbed in the skin as, this was the question. So the answer is like kind of a dehydrocholesterol will be a good answer. Okay. So, and what is the active form? Active form of vitamin D. The active form of vitamin D is 125 dihydroxycalciferol. This one, this 125 dihydroxy vitamin D. This is the active form of vitamin D that you should know. It's an MCQ. In the treatment management for rickets in general, we give this vitamin D sachet. In the treatment management, we give vitamin D sachet, or something known as, it's already written over here. See, cholecalciferol sachet, or nothing but calcirol. So cholecalciferol sachet or calcirol. So cholecalciferol is this only, this one. 120, one second, this one, 125 dihydroxy vitamin D, this only the active form, which is calcitriol, calcirol. So this is something we give to the patient, 125 dihydroxy vitamin D. So this is we give to the patient. Cholecalciferol is active form of vitamin D, MCQ. 60,000 international units per 1 gram. The sachets of 1 gram, and 60,000 international units is what we give. Vitamin D3 granules in 1 gram. This is like really very important. Image based question, treatment, management. We give this usually, remember, 6 sachets. Okay, if you say, yeah, before we used to give total of 10 sachets. I'll repeat again. This one sachet, 10 sachet for 10 Saturdays we used to give. Now we have cut short the treatment into 5 sachets. One sachet every Saturday for 5 Saturdays. 5 Saturdays means 5 sachets will give. So 6 into 5 is 3. So 3 lakh international units. 3 lakh international units. It's an MCQ. One second. Yes. So what is the treatment regimen for vitamin D? Remember, we give very importantly 3 lakhs of international total treatment for vitamin D will be 3 lakhs international units of vitamin D in divided doses. One sachet every Saturday for 5 Saturdays. 5 sachets you have to give. Okay, so this also we have a patient, a very wonderful patient. So a 2-year-old child came with complaints of bowing of legs. You can see, make out very wonderful. This baby has bowing, or can we appreciate this? This is bowing of legs. Okay. So number one, a lot of questions are there. Is this a genu varum or genu valgus? This also very so this is a genu valgum or genu varus. So remember that. Imagine, so this is a varus. So this deformity is varus. Okay. So the baby can have a knock knees also. When the two knee joint are stick together, that is known as knock knees, which is known as genu valgum. Okay. This one, the photo is genu varus, but you can also, the baby can also present in the form of genu valgum also. Okay, genu valgum also. And in genu valgum, very, very importantly, there'll be knock knees. There'll be, the knees will be clubbed together. Okay. And one more thing, very beautiful, this thing we need to know, that what are the like other causes of bowing of legs. Everyone knows bowing of legs rickets, bowing of leg rickets. But examiner might ask you other causes of bowing of legs. So very beautiful it is written. The other causes of bowing of legs, number one is rickets. Number two, it is any bone dysplasias, kind of a naturally, any bone disorder, bone dysplasias. Third is fluoride or lead poisoning. Fluoride or lead poisoning. Fourth is Blond's disease, rare of the rare, Blond's disease. And number five is osteogenesis imperfecta. Okay, why it is not all these disease, why it is only rickets? Because the number one, if you get a vitamin D levels of this patient, that will be low. Vitamin D level will be decreased in this patient, number one. Number two, why it is not what you called osteogenesis imperfecta? The triad of osteogenesis imperfecta is history of blue sclera. The baby will have blue sclera with recurrent fractures with deafness. I'll repeat again. Osteogenesis imperfecta is history of blue sclera with recurrent fracture and deafness. Rickets patient does not have fracture. They will have bowing of legs, but they will not have fracture. Okay. So fracture, if it is there, then automatically your answer becomes osteogenesis imperfecta. This is a very nice question, which is the slide is very, very crucial for exam purpose. The 5 differential diagnosis of rickets is nothing but is of bowing of legs is rickets, bone dysplasias, lead or fluoride poisoning, Blount's disease, and osteogenesis imperfecta, which is also known as brittle bone disease. And the triad was history of blue sclera with recurrent fracture with deafness.